oral presentation at ACHA on this. So the neighborhood leaders all got together. Now this was a good 5-6 years ago, before this area. This area is now starting to develop.
Yep.
But at that time there was no place to go to get healthy food.
Okay.
So the neighborhood presidents got together and said, what can we do to up the quality? Because there were restaurants here, but they were all chicken wings and processed Chinese food and nothing fresh.
Yep.
So we got together and we decided to cash mob the restaurants around here, and we came up with 5 criteria. If the restaurant would promise to provide a safe environment, so keep it well lit. I don't know if you can hear me. All right.
Yep.
If you keep it well lit, be welcoming to everyone who walks in, so that addresses the gentrification.
Yes.
And offer clean, safe, and then offer a healthy item on their menu. If they promise to do all of that, then we would bring all the neighborhood people to that business.
That's great.
So it was a cash mob, and we were expecting, and it would all happen like on one weekend, so that they would really see the difference. So we'd show the owners that that it's good for business.
Free marketing, free publicity,
to offer healthy foods.
Absolutely.
So we started it. We had the first one at a little bowling alley up here on Metropolitan Parkway. We were expecting maybe 50 people to show up. We ended up having almost 100, and we had over 120 people show up.
Wow. Okay.
We were delighted with it. Creative loafing did a story on us and everything.
Really?
And I can send you the link.
That's really nice because again, you're pairing the community up with the business owners.
Right.
And the two often don't speak to each other.
Right. Now, because what they were saying was, people want chicken wings here. They don't want anything else.
Exactly. Well, if that's all they're exposed to, then obviously they're not going to know what the grass is greener on the other side. It's with respect to businesses here. Do you know the demographic of business owners? Do you see that in a neighborhood like this that's gentrifying? Is it still, black-owned businesses, or is it white businesses that are moving in?
So there's a combination. There's a real movement. There's a real movement to keep black, we call them legacy businesses.
Yes.
Black legacy businesses supported. Like, for instance.
No. Now we can.
This is the dangerous street to cross.
Yes,
I'm serious.
I know.
Like the state of Georgia ranked them all. So right here is a legacy barbershop.
Yes.
And when they talk about, so they keep talking about wanting to put a diner here, trying to cater to the newcomers. But every time they do, the community says, don't throw him out.
Yep.
And they always try and find a corner in the new design to give him, so that he doesn't have to.
Interesting. Also very interesting that it's within and part of the Masonic Lodge.
Yeah, well, it was. So now it's been sold.
Now it's been sold? Okay.
Yeah, but it's a gorgeous building. It's a really gorgeous building. So I could show you, let's cross over on this side.
We're going to need a crosswalk. Doesn't matter.
It does matter. So another project that I worked on through Morehouse was called the Healthy Corner Store Initiative.
Okay.
And it was a CDC funded REACH grant.
Okay.
And so we went to the corner stores, and we tried to get them to carry healthy food, but without subsidizing it, right? So we would give them signage for their stores and try to talk them into, if you're going to have a frozen cabinet for ice cream, why don't you put some frozen vegetables in there, right? And make it so that people can really get decent food at the corner store. And so that was an exciting project to be on. But see, this is the kind of thing that we're constantly fighting, trying to get this cleaned up.
Yep.
Now, if you want to take pride in your neighborhood, it's more than just pride. It's a matter of, it's a health issue too.
It is.
I'm going to show you this next property up here that's been boarded up. I've lived here for 10 years and it's been boarded up for at least 10 years. And it's a brownfield.
Okay.
So that means that it used to be a dry cleaners, and the dry cleaner put all kinds of chemicals in the soil.
Yep.
So there are all kinds of remediation that needs to be done.
Yes.
Before it can be sold and developed.
Yes, and that doesn't only affect this particular place, but houses around it.
Right.
And other stuff like that as well.
So, but now look at it, it's an eyesore. And it's been an eyesore for how long? And not only an eyesore, like I said, rats and vermin. And then you have a huge problem with tire dumping.
Yes.
And that holds water. You see how there's water in there?
Yep. Mosquitoes.
And mosquitoes.
Yep.
And then, you've got a lot of mosquito-borne illnesses. Look what a mess this is. And we used to have the Sullivan Center was a community center run by Sister Maria O'Sullivan. And they moved because I think it was a rental issue.
Okay.
It was just a rental issue, but they moved, and so now they used to have, assist people with applying for SNAP benefits.
Sure.
And health insurance.
So when organizations like the Sullivan Center move out of the neighborhood,
so they move to the other side. They move to the other side of the interstate. So they're not that far.
They're not that far?
But they're really not within walking. They're certainly not within walking distance.
So who's there to help people sign up for SNAP or?
So they're getting ready to build a resource. What's it called? At Promise Center.
At Promise, okay.
And that's being run by the Police Foundation.
Okay.
And that'll be Chris 180. Have you ever heard of Chris 180?
Yes. Yeah, I was just talking to them the other day.
So Chris 180 has the contract to manage that. So there'll be
very
all
nice.
kinds of intervention. There'll be lots of intervention for.
And this is a home, I'm assuming?
I don't know. It was a business, but at least they're keeping, it halfway decent, right? When you see down here at the Sullivan Center, you can't see, but that's if you look down the hill, do you want to see it?
Sure.
There's all kinds of.
Careful.
There's raised. So Home Depot had this big project where they donated the wood for raised beds.
Okay.
So it was a huge community garden back here.
Oh, wow.
Huge community garden. For all the plants in it. But now, this is all closed off.
Someone's backyard?
Huh?
Is this someone's backyard?
No, this is the Sullivan Center.
This is still part of their property.
This is the Sullivan Center. So the Sullivan Center clients would be able to garden here, but now it's just a weed factory. And look at that poor, sad American flag.
That is a good visual representation of everything. So one of the questions I always ask people, because I'm a policy-driven person, right? So one of the questions I ask is, given your role as a CHW, given your experience as a CHW, if I was to give you a magic wand and say you're a Georgia legislator for a day, what is one thing you would implement, particularly in this area, since you're so familiar with it, with this neighborhood, that would bring about the most change in your opinion?
So I was just thinking about that. That's funny that you would ask that.
Yeah.
I was, because someone was saying, they had a post saying what would be your 3 top priorities.
Yep. You can even give me top 3. That's fine.
Okay, and one of them would definitely be education.
Okay.
Because I think education is the way to empower communities.
Yes.
And right now, our education system is completely failing our youth.
Absolutely.
Our society, not just our youth, our whole society, because I think the success of society is really dependent on the success of our youth.
Yes.
And I don't say that everyone has to be college prep. I think they need to have a
Vocational
very
schools,
vigorous
yep,
vocational, and they need to get them hooked on vocation
Yes.
in junior high, so that we don't have the massive
Yes.
dropout
Yes.
rates.
And rate of unemployment as well down the line.
Right, exactly.
Well, Germany is an interesting country to look at, where I think 50 or 60% of their population does vocation-related stuff, right? And so that's why they have such great engineers, is because a lot of them are prepped from an early age to do these vocation-related skills. So education is one. What are your other two?
So I think we have a housing crisis.
Yes.
So I think affordable housing, affordable, healthy places to live.
Yes.
So it's important to not only have a place, an affordable place to live, but a place where you feel comfortable coming out and walking.
Sure.
So we're walking now. I would not be walking the street at night.
Yeah, I hear
This
you.
is not a place where very many people are very comfortable
And that
walking at night.
adds to a lot of mental stress in the community.
Absolutely does. And then you add, so you asked me to talk about COVID.
Yes.
But concurrent with the COVID crisis has been the racial crisis.
Yes.
George Floyd, the death of the murder of George Floyd, Breonna Taylor.
It's sad because now there's so many names and we can't keep up.
Right, exactly. Ahmaud Arbery.
There's so many names.
So that was heartbreaking to all of us.
Yes.
Then Rayshard Brooks.
Yes.
That was right.
I did not know that. The Wendy's?
The Wendy's. So you got off on University to
Yes.
come here?
Uh-huh.
If you had taken a left, not even 100 yards from the interstate was where the Wendy's was.
Oh, wow.
You heard them talking about University?
Yes, I did.
That's where you.
Oh.
So.
It's sad when you're able to identify a place
Right.
with a murder.
Yeah.
You know?
So, and I think that was such a terrible, terrible situation.
So you had education, and then you had
affordable, safe. I'm kind of putting two together there, but having so the Beltline is coming.
Yes.
Here, and that's kind of also a double-edged sword, because it'll be on one hand, it'll be a safe, lit place for people to go walk. But on the other hand, it's going to drive demand for the housing in the area.
It will.
It's going to drive up. So that's, and that's a direct result of COVID.
Yep.
I can tell you from my own experience. That I became very depressed.
Yep.
Being alone, home alone. I was such a social person. I was going to meetings, 2 or 3 times a week. And then, bam, complete isolation. So, when we finally came back.
No, Morehouse is back?
Morehouse is back now, 4 days.
Hybrid,
Yeah, hybrid, right. If you have your own, office, then you come in 4 days a week.
Okay.
Hey. So, but that's the house I was telling you about that the city just took ownership of.
7:30.
7:30.
And the thing that you just shared, thank you for sharing that with us.
And I went to the doctor and got on an antidepressant.
It's just.
And now I'm feeling better. But I think that I'm feeling better as much because I'm getting out of the house.
Good.
But I'm still very afraid.
Yes. I mean, us human beings are not designed to be enclosed for a long period of time.
Right.
But I'm glad you're feeling better, and I'm glad you're getting the medical attention that you needed.
Yeah.
The only other the thing that I would say is like.
Oh, the other thing I haven't mentioned to you that really has to do with community health is there are no medical facilities nearby.
Really?
Yep.
What's your closest hospital to your neighborhood?
It would be south, down on Cleveland, probably 8 miles away.
Really?
Yeah, at least 8 miles, maybe. You can do it
By Sylvan Avenue, Sylvan Road? No?
No, all the way down to Cleveland.
Oh.
So do you know where Cleveland is?
Yeah.
And then you go take a right. It's East Point. Actually, it's in East Point.
So with that, how does a community like this deal with COVID when medical attention is so far away?
Yeah. So it's.
Is that where you guys come in as CHWs?
So one of the things that because I think I sent you some emails.
Yes, you did. Yeah.
So one of the neighborhood leaders asked me for. He was one of the ones who was without insurance. He said, "Can you send me a list of local federally qualified health?" He didn't use the word federally qualified health center, but he said clinics that offer a sliding scale or free services. And so I did that, and this was really done by my coworker, so I can't take credit at all for it. But my coworker pulled together a list of all the federally FQHCs in the area that offered sliding scale or free health care, but got it updated because during COVID, you would think that, I'll call this one, and they're closed because of COVID.
Yep.
Right?
Yep.
The other thing that I think is an untapped resource for community health workers is to do more outreach to the churches.
Okay.
So the other phenomenon that people might not realize is that some of these churches are churches where the congregation does not live in the area.
Okay.
So maybe they grew up in the area and then they went to the suburbs.